checking pupil reactivity. So if you will, just stare at my forehead. Okay, and if you will follow my pen. Okay, pupils are reactive to light and are equal. Okay, do you mind smiling for me? Okay, good. Face and smile is symmetrical. Okay, so if you will, can you hold out your hands? So I'm going to test for strength. Do you mind pushing up? Okay, good. And push in. Okay, good. So we're going to move down to your feet and do the same thing. Do you mind pushing up with your feet? Good. And push down. Good. So strength is equal bilaterally. So I'm going to go ahead and get some of your pulses. So I'm going to check your dorsalis pedis. Good. Pulses are equal. And then now I'm going to get your posterior tibialis pulse. Good. Pulses are equal. And then I'm also going to check for edema. Have you had any tenderness in your legs or any swelling? Okay, so no edema noted. Okay, so I'm going to wash my hands since I just touched your feet. Okay, and I'm going to check your radial pulses. So can I see your wrist? Okay, pulses are equal bilaterally. And then can you hold out your hands for me? I'm going to check for capillary refill. And that seems to be normal. And then there seems to be no cyanosis or clubbing of the fingers. So now I'm just going to move to palpating some of the neck. So I'm going to feel for your trachea. And trachea is midline. I'm going to check for any lymphadenopathy. Okay, and there seems to be no enlargement of the lymph nodes. And then I'm also going to check for the thyroid. Okay, so there seems to be no thyroid enlargement. And so now I'm going to palpate the carotid arteries. And that seems to be good. Pulses are equal. And so now I'm just going to listen to a couple of things, starting with the carotid artery. I'm going to listen with it with the bell. If you will, hold your breath for me. Okay, everything sounds good and no bruits noted. So now I'm just going to move on to listening to your heart, starting with the aortic valve. Next, the pulmonic, herbs, tricuspid, and mitral, which is also the pulse of maximum impulse, or PMI. Okay, so I'm going to turn it and use the diaphragm and go back up. Okay, let's just tricuspid, herbs, pulmonic, and aortic. Okay, and so now I'm going to listen to your lungs. So if you, every time I place my stethoscope, we could take a deep breath in and out. Okay, can you lift your arms up for me? Okay, and now I'm going to listen to your posterior lung. So if you'll turn this way for me. All right, and I'm going to listen laterally. Okay, everything sounds good. Rate and rhythm is good. Okay, you turn turn back this way, and we'll lay back on your back, and we're going to do an abdominal assessment. So first glance, assessing the abdomen, it's flat and there seems to be no pulsating masses or lesions, so everything looks good. So now I'm just going to listen, starting with the right lower quadrant, right upper, left upper, and then left lower. Okay, everything sounds good with hearing bowel movement in every quadrant. So now I'm just going to lightly palpate. Let me know if you feel any tenderness or pain, starting with the right lower quadrant, right upper, left upper, and then left lower. And so now I'm going to deeply palpate. Do you feel any pain or tenderness when I'm palpating? Okay, good. When was your last bowel movement?
Yesterday.
Okay, and do you have any problems urinating or any pain while urinating?
No.
Okay, good. Okay, everything feels good and normal. And so now I'm just going to assess your back for any skin breakdown. So if you'll roll this way for me. So I'm going to assess the bony providences, which is the elbow, the scapula, sacrum, and coccyx area, as well as the heels, and there seems to be no breakdown or redness. So you can roll back over and sit up. So that was the end of our assessment. Thank you so much for letting me do this assessment on you. I'm going to give you your call light, make sure your sheets are neat, and that
I'm going to perform the range of motion for her. I'm going to have you bend forward, backward, sideways, and rotate it left to right. Any pain in there?
No pain.
Okay. Now I'm going to palpate her cervical lymph nodes. This is the preauricle. This is the postauricle. This is the occipital. This is tonsillar. This is the submandibular. This is the submental. This is the posterior cervical, and this is the superior superficial cervical. And while I'm here, I'm going to assess your thyroid gland from behind. I'm going to have you bend your head and then swallow. Any issues with swallowing? Any difficulty?
No pain.
Okay, so there is no nodules noted, no enlargement or any tenderness or pain with all her cervical lymph nodes. I'm gonna go ahead and go to the next part of our assessment, which is the shoulders. Her shoulders obviously does not have any obvious deformities or anything like that. I'm going to go ahead and palpate her axillary lymph nodes. Okay, this is your pectoral. This is your subscapular, lateral, and your central. Any pain in there?
No.
Okay. You have it just like that. Pectoral, subscapular, lateral, and your central.
No.
Any pain? Okay. And well, I'm going to go ahead and palpate your sternoclavicular lymph nodes. This is the acromioclavicular and subacromial area. Any pain?
No.
All right, no pain or tenderness noted. And then I'm going to go ahead and assess your range of motion. I'm going to have you raise your hand all the way up, sideways. That's abduction and adduction, and then forward all the way up. That's flexion and extension. And do you have any pain in there?
No.
Okay, so no restrictions in movement of range of motion. Now I'm going to go ahead and assess cranial nerve number 11, the spinal nerve. I'm going to have you shrug. Okay, and then I'm going to have you shrug against my hand. Very good. And then again, that is assessing spinal accessory or the cranial nerve number 11. Now I'm going to go ahead and assess your elbow range of motion. I'm going to have you extend it and flex it, and then inwards and then outwards. Okay, very good. So, and then I'm also going to have you push up against my hand resistance. Okay, push down. Okay, upper extremities is 5 out of 5, which is a normal finding, and there's no issues with movement as well for her range of motions of her elbow. I'm going to go ahead and proceed to the next part of our assessment, which is the anterior chest. So her chest obviously does not have any deformity or anything like that. Her movement is symmetrical, And the normal AP to lateral diameter is 0.7 to 0.75. I'm going to go ahead and have you lie down here. Okay, now I'm going to check for your carotid arteries, and we'll just do it one side at a time. Okay, it's 2+, and I'm just going to auscultate your carotid. Okay, so no bruise heard in her carotid arteries. Now I'm going to go ahead and auscultate this is her aorta, pulmonic, tricuspid, and then the mitral. And there's no bruit heard upon auscultation. Casey's cardiac rate is regular in rhythm, and the location of her PMI was auscultated in the 5th intercostal space, mid-clavicular line. And then while you're here, I'm also gonna inspect or auscultate your breath sounds. Take a deep breath for me. Good. Good. So all lung fields are clear, no diminished sounds or no adventitious sound heard upon auscultation. So that is culminates our anterior chest. We are going to proceed to the posterior chest. I'm going to go ahead and have you seated on this edge for me. Okay. All right. I'm going to have you say 99 for me.
99, 99, 99, 99.
Okay, I'm going to percuss your chest wall. So resonance is the normal finding for all her lung fields upon percussion, which is a normal finding. The other way to assess the lungs is also doing the egophony, is having the patient say the vowel E, and if there's any consolidation or anything like that, that vowel E will sound like a vowel A. So again, her lung sounds are all clear, no diminished sounds or no adventitious sound heard upon auscultation as well. Okay, I'm going to proceed to the next part of our assessment, which is the abdomen. Okay, so her abdomen, there's no pulsation, no deformity. It is not distended, it's symmetrical, it's round, which is all a normal finding. Now I'm going to auscultate your vowel sounds. All right, all her vowel sounds are normal, active in all 4 quadrants. Now I'm gonna percuss your abdomen. As I'm doing this, I'm also assessing any like liver enlargement or spleen enlargement. So there is no signs of liver enlargement nor spleen enlargement, and you can assess that by percussion as well. Now I'm gonna palpate, do a light palpation in all 4 quadrants, and you tell me if there's any pain. Any pain?
No pain.
All right, as I'm doing this, I'm also palpating her urinary bladder. Do you have the urge to pee right now?
No.
Okay, which means that her urinary bladder is empty. Now I'm gonna do a deep palpation in all 4 quadrants using both of my hands.
No pain.
Any pain?
No pain.
Okay. So there's no pain. I'm going to do a rebound tenderness test, or what we call the Murphy sign, and it's putting pressure on the right side of the abdomen. Any pain?
No pain.
Okay. A positive Murphy sign would be when the patient has inspiratory arrest. And we're going to also do a SOA sign. We're going to bend this knee. Any pain?
No pain.
Okay. And then while we're here on this side, we're also going to do the obturator sign.
No pain.
All right. It is negative for psoas and obturator, and I'm going to do it on the other side as well. This is the psoas sign. Any pain?
No pain.
Okay. And this is the obturator.
No pain.
All right, very good. Okay, and that culminates the abdomen. I'm going to have you sit on this edge for me. Now I'm going to assess her CVA for any kidney pathology. Any pain?
No pain. No pain.
So that is assessing the costovertebral angle, which would tell us any kidney pathology, which is, she is negative for that. And we're going to proceed to the next part, is the lower extremity. I'm going to have you lie down again. So for her hips, there's obviously no deformity. It's not no bruising. It's not edema or anything like that. I'm going to palpate your anterior superior iliac spine here. Any pain?
Okay.
So what we can also palpate,
just gonna check your joints. Any tenderness? They're not warm, red, swelling, so that's good. And check your hip joints. Any tenderness? Okay. Could you do this for me? Go like that, in like a cheerleader, and go like this, and like this. Great range of motion. Could you, okay, and then go like this, just like that. Okay, range of motion there. I am gonna have you lay down, please. Okay. I'm gonna come over here. Okay. So I'm inspecting. I don't see any heaves. I'm gonna check for thrills. Checking the PMI. Nope. Okay. Now I'm going to check the heart again. Using the diaphragm. And switch it over to the bell. Oops, I'm so sorry. No worries. And if you could turn to your left for me, please. Check the PMI. No worries. And I can hear it much better. Okay, thank you. Now I'm gonna check the carotid. Upon inspection, palpation. Good. Now I'm gonna have you hold your breath, and then I'll tell you when you can breathe out. Okay, so if you can hold your breath for me. And breathe out. At the same time, hold your breath. And breathe out. Great. Now I'm going to I'm going to show your stomach. I'm going to listen for abdominal bruits, so the aortic, renal, iliac, femoral. I don't hear any bruits. Now I'm inspecting the abdomen. It's flat. Now I'm going to listen to abdominal sounds. Well, hyperactive. Not right upper quadrant. Okay. Now I'm just going to percuss. I'm gonna do light palpations and then deep, and tell me if you feel any tenderness. Feels okay? Okay. I don't feel any masses. Abdomen soft, non-distended, not firm at all. Thank you. Gonna check for edema. No pitting edema. Okay, now I am going to check the radial pulses. Good, 2+ pulses. Check the femoral. I'm also going to palpate the inguinal nodes, any tenderness. Okay. If you could bend your knees slightly for me. I'm gonna check popliteal, posttibial, and pedal. Could you lay your legs a bit flatter for me? Thanks. Great. I'm going to check cap refill on the toes. Less than 3 seconds. Sorry. Check on the fingers. Less than 3 seconds. Great. Now I'm going to do some range of motion with your legs. If you could take your knee and put it to your chest, one at a time, great. And then if you could slide your foot and do the same thing but keep it on the bed, great. Range of knee of knees, other one as well. Thank you. Now I'm going to have you whichever leg first, bring it out, and then cross it over. Good. Same with the other. Great. And if you could go like this with your feet, like that. Inversion, eversion, wiggle your toes. Great. Span them out if you can. Great. Now I'm going to palpate the spleen. If you could take a deep breath for me. Okay, breathe out. I can't feel the spleen, which is normal. Now I'm going to do the liver. If you could take a deep breath in for me, breathe out. Okay. I'm going to some percussion. Okay. Great. Think that is good. Okay, I'm going to have you sit back up. Now I'm going to check your joints. Just have your arm relax. Okay. Great. And relax. And relax it. Now I'm going to check your knees. If you could scoot up a little bit for me. And have your hands like this and look away. Now I'm going to check the Achilles.